how to expand our patients' diets. Practitioners do it all kinds of ways. So a key point here is there's no one right way of how to expand diet or do food experiments. I'm just going to share my way today. I have a very simple way that works for me and my patients, and I'm just going to share that with you. I like to start with the foods that they or their family most desire, because usually there's anywhere from 2 to 5 foods that would just make a huge difference for them to be able to have. And so it's like, what is it that would make your whole life better if you could have it, like you could all eat the same thing at the same table or whatever. And we just begin by testing that food. Can they have that food? So this is how I recommend doing that. Just start with a small amount to minimize any possible bad reaction. So 1/4 of a cup or less, smaller for things like garlic or onions, where you're not using much in a whole recipe. So that is going to be a very tiny amount. And then what you do is you have them watch for symptoms that day and through to the next morning to watch for like what might happen with bowel movements the next morning. If everything's tolerated, if no symptoms have flared up, then the next day, day 2, increase that food by double. So you go from 1/4 a cup to 1/2 a cup. And then you just continue that process each day until the patient reaches the normal amount of that food that they would eat at a given time. It might only be 1/2 a cup, so maybe it's only a 2-day experiment. And then when they've done that, okay, that one's tolerated. Now you move to the next food. Now, what if the food isn't tolerated? If they try 1/4 of a cup and they got a flare up of symptoms, then they need to wait till they are recovered to try the next food experiment. And that's usually 1 to 3 days. And also, they can use the supplements that are on that handout that we showed you to help them if they flare. So that's really important that they have that handout. Portion size really does matter in terms of tolerance. So starting with a small amount and then increasing will also help patients find how much of that food that can be eaten, because a lot of times somebody could have, let's say, 1/4 of a cup of something, no problem. But if they ate 3/4 of a cup of it, it will be a problem. So by doing this, sequential increasing of amounts, they can see, I was fine with 1/4 of a cup. So I'll just know that. Now, coming back to other strategies, the next thing you could do is you could start with what they need most medically. Like maybe if they're underweight, you're going to start with starchy foods like white potatoes or white rice or white bread. Or maybe you'll see if they can have dairy. Maybe they had a dairy allergy. So now you're going to try lactose-free dairy, and then you might try lactose-containing dairy. Whatever you as the practitioner think they medically need to have. And then a third option is to start with onions and garlic, because these are ubiquitous in everywhere, right? So if they can go to a restaurant and tolerate a meal that was made with garlic or onions, then we know that they're going to be able to tolerate eating out, and they're going to be able to tolerate their friends cooking and such. So that's another thing to try. So those are just 3 strategies. So when do we do this? When do we try to expand the diet? Typically we wait until after antimicrobial treatment. And after that antimicrobial treatment, they can start doing these experiments right away. But often I wait for about 2 weeks once they've finished the antimicrobial treatment, just to see how things shake out. Like, especially if you've had to do a lot of multiple rounds, if it's a more challenging case, just give them a little moment of a breather, and then we can start the expanding. Now, I have to say, sometimes patients are gung-ho and they just want to start right away. The other way you can do it is you could wait and start expanding the diet after that common relapse window of about 2.5 months. So you could start at around 2.5, 3 months. Really, there's no one right way, and it does depend on the case and the willingness of the patient. Now, here are some diet expansion notes. Because there can be confounding factors. There's always confounding factors in our patients' lives and in our lives, like their menstrual cycle, or maybe they're starting other new medicines or supplements and they're not thinking about the fact that they did that right on the day they're doing their diet expansion. I'm telling you, you can type in the chat if you've had this happen to you. I've had it happen to me so many times. It's like, wait, we were doing an experiment. And they're like, well, I also decided to do 3 other experiments at the same time. So because of that, they might need to repeat the experiment 2 or 3 times because maybe they aren't clear, but by the 3rd time, no matter what, usually they can really tell. And also just note that tolerances change over time. So they're going to be worse if they have a relapse, right? And they're going to be better. Their diet can expand better when we treat and manage them over time. And I find the biggest hurdle with diet expansion is often the patient's fear. And I think with that, they usually just need to gain some confidence over some time to have their symptoms be gone as we've worked to reduce their test or their symptoms are reduced. And also we can educate them about those symptomatic relief supplements that they can use while they're experimenting in case they get a reaction. So my biggest suggestion here is just keep encouraging them to try. There's a lot of fear to overcome, but with your loving encouragement, they'll get there. Now, the super good news is many SIBO patients can expand their diets after SIBO eradication. I mean, it's really true. So we see patients be able to tolerate more foods again. They get over their lactose intolerance. They get over their fructose intolerance. They can add fibrous grains back and all kinds of fruits and vegetables back in. So this truly happens. So I just encourage you to work on expanding your patients' diets and use these simple methods. And on this uplifting note, that is the end of my presentation.